Good morning, I'm Dr. Deuk. We're streaming live spine surgery from Deuk Spine Institute here in Melbourne, Florida. Our patient travels here from Ponte Vedra, so Florida. She has neck pain, and the reason she's having neck pain is two specific causes. One is she has two damaged discs, number C5-C6, C6-C7, that are degenerated, causing her neck pain, and she has facet joint pain. We're going to start by treating the facet joints that are arthritic and painful, causing her neck pain. So we have to fix the facets and the discs to get rid of her pain. We're starting with the facets. And just, Henry, do you mind showing the audience these 30 different causes of chronic neck pain so they can understand the different causes while we get started?
Of course.
I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. And welcome back. You can see that there are 30 causes of neck pain. They're not equal in their incidence or prevalence. And the facets are the second most common reason people get chronic neck pain. The disc is the first. We haven't treated her disc problem yet. We're about to do that. But I want to show you on this x-ray. Take a look at the cervical spine. Look at the bone spurs she has coming out of her facet joints. Like, look at the probe. Just above the probe on the side there, there's a massive bone spur. I mean, it is humongous. And it really starts medially there. Yeah, circle the whole thing. Yep. Gigantic. All right. What causes this? Arthritis. So she injured her facets years ago along with her discs, and over the last 20 years they've just degenerated and they're just causing horrible pain for her. And if you have pain when you turn your head side to side or look up at the sky, that is facet pain. Deuk Spine now has the only permanent cure for that. It's called the Deuk plasma rhizotomy. Let's show the audience how facet joints can be so painful and how we fix them.
Of course.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our videos that the facet joints, when they get injured, there's a capsule tear. Over time, you get inflammation of the facet, and the best treatment in the world is to go in and destroy the pain nerves to those joints, and that's what we're doing right now. I've just completed that process. Shot? All right. There's massive, massive arthritis here. I've not seen arthritis this bad. And it just indicates that her injury was quite severe. We're done with the right side. We're going to go over to the left side next. If you have questions, feel free to type them up. So you've seen that there are 30 different sources of neck pain. Deuk Spine Institute is able to identify or diagnose the source of neck pain in almost every patient. And 99% of the sources are completely fixable, curable. All right, we're going to switch to the left side. So there's T1. Show us T1. Correct. And then 7, 6, 5, 4, 3. Yep. So we're going to make our incision on the left. It's a 4mm incision. You saw that during the video, 4mm incision. This is a Band-Aid incision, folks. And the great news, there's no hospitalization. This is completely outpatient surgery. Patients basically go home an hour after the surgery is done. So they just recover for an hour and then go home. In her case, she has another surgery right after this. It's going to be the cervical Deuk laser disc repair. Henry, you want to show the audience what the Deuk laser disc repair is all about?
Of course.
To fix discogenic pain, which he has as well.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our video how we fix disc pain, and you've also seen how we fix facet pain. Currently, we're treating her facets. We're about to flip her over and do her disc surgery, so we're going to end this stream in a few minutes, and we'll be back for the longer Deuk laser disc repair that will take us about 45 minutes to an hour. The facet treatments are quicker. We've lost literally 2 drops of blood. This is a bloodless surgery, and the pain relief is permanent. Unlike the RFA, which has been what everybody's getting and doing, the RFA pain always comes back every time. It never lasts forever. The RFA is temporary. That's why we don't recommend it anymore. because now we have the actual permanent fix, and it's called the Deuk plasma rhizotomy. So if you've had RFAs before, they've given you some temporary relief, it's time to come in and get the Deuk plasma rhizotomy, so you don't have to keep going back to your pain doctor getting more and more procedures, shots, pills. It's time to say goodbye to your pain management doctor and get fixed permanently. All right, we'll take questions.
This question coming from MSM on YouTube,
Hello, MSM.
asking if someone has a disc tear causing their discs to become thinner, but the tear isn't the source of pain, what if facet joints and piriformis are the sources of pain? Would you still fix the tear?
Yeah, I would not fix the tear unless it's causing pain. We don't do surgery unless the disc is causing symptoms. Now, I believe your disc is the cause of your symptoms. So you're saying it's not. I think it is. And the reason I say that is because 85% of chronic back pain comes from a disc injury. So the other causes that you've listed, unless I personally examined you. By the way, here's the incisions on the back of her neck. One on the left, one on the right. They're 4 millimeters. Look at that. Can you see that?
Yes, we can.
Is that even 4 millimeters? Yeah, it's 4 millimeters. It's probably 4 millimeters. Okay? And all we're going to do is put a little staple, and we'll get that out in the morning when she comes back in for a checkup, and a Band-Aid. Staple and Band-Aid, done. We're going to flip her over and get the front of her neck and do the laser surgery. So to answer your question, though, we don't do laser surgery on the disc except to treat symptoms. So people with a tear or herniation that are asymptomatic, I don't recommend surgery for. The symptoms must be coming from the disc. And I would bet that your symptoms are coming from your disc, unless I personally examined you and said they're not. But that's very rare. Most of the time it is. Okay, any other questions?
No current questions.
We'll be back in 15 minutes for the cervical Deuk laser disc repair.